Okay, go.
Okay, so this is hip pain. In a patient with hip pain, I would do the same thing. I would do a, sorry. I would still do the same thing. I would do the seated styles screen. Could be in the lumbar spine, so really checking this lumbar spine, which he does not move very well in his lumbar at all. Do the same thing over here. Okay. And then I'd kind of look to do more of the styles in the more of the lumbar region. And I do feel a little bit of hypertonicity right there. So maybe that'll be one we go after. Okay, so that's the lumbar spine. Oh goodness. Okay. Uncross your legs for me. I would also check motor. So put your legs up to the ceiling, like push them up. Okay. And push it back down. Like push it down towards the bed. There you go. Push this one down. Kick this guy out. Kick this guy out. Okay. Pull him back in. Like pull him back towards the, there you go. Pull him back in. And push him in this way. Push him out. Push him out that way. Okay. Push him in this way. Like pull your whole knee in. Does that make sense? Mm-hmm. Okay. Push it back out. Okay. So it's pretty good motor strength. And I would also come back here and just check the posterior ribs because that could kind of be contributing to some of his pain. Not really feeling anything there. Okay, and then can you lay down for me and put your head all the way by that pillow? And then I can just do a really quick assessment this way, just to kind of see if he's stuck in internal rotation or external rotation. He likes external, but he doesn't seem to like internal very much. Let me see here. Still not really liking internal rotation, but liking the external rotation. Okay, you can sit up for me. So in this patient, I would probably go for the hypertonicity I was feeling on this side on the right. And I'd treat him with a styles. So I would localize that spot and I would kind of move him into flexion extension, side bending and rotation until I felt that spot soften under my finger. And then I'd put a compressive force on it and then I'd swing around the arc. And I would tell my patient that I found a spot in his back that may be contributing to kind of his hip pain down lower in his lumbar spine. And that I was going to use the still technique, which to kind of relax that muscle, swing it through its arc and kind of loosen it up so to get that pain to go away. And then I'd reassess and do the same thing, just kind of go down the lumbar spine and hopefully that spot would kind of go away. And that's what I would do for hip pain.